Just a few key objectives that we'll talk about today. Obviously, identifying the key components of Handle with Care, the Trauma-Informed Community Initiative, recognizing those cross-discipline collaborations, and then understanding how adverse childhood experiences impact children and the proactive measures that educators and first responders can take to promote resilience. So just a little bit of background information. SCDHEC received grant funding from the National Association of County and City Health Officials and the Center for Disease Control and Prevention for the Comprehensive Community Approaches to Preventing Substance Misuse grant. One goal for this was to build resilience and increase positive childhood experiences to prevent future adverse childhood experiences and mitigate harm in individuals who may have been exposed to ACEs. Our strategies included partnering with cross-sector organizations, conducting trauma-informed trainings, supporting programs that strengthen parenting skills, and implementing programs like Handle with Care that ensure a strong start for children. We partnered with various local organizations and counties within the upstate and midland regions of South Carolina. We began implementing Handle with Care in June through the grant, and the grant ended in July 2023. Over the course of one school year, 10 school districts successfully implemented Handle with Care, and we have repurposed the previous Handle with Care grant strategy as a tool in a new initiative called Embrace, which will allow our teams to continue addressing ACEs in communities across the state. Embrace stands for Empowering, Mobilizing, and Building Resilient ACE-Aware Communities and Environments. The goal for the Embrace initiative is to build resilience and increase positive childhood experiences to prevent future ACEs and mitigate harm in individuals who have already experienced ACEs. Our strategies include partnering with cross-sector organizations, conducting trauma-informed trainings, supporting programs that strengthen parenting skills, and implementing programs that ensure a strong start for children. It's important to note that the toxic stress associated with ACEs can lead to negative health outcomes in adulthood. They are linked to many of the health, mental, and social outcomes pictured. The higher your ACE score, the more likely you are at risk for experiencing an early adversity. However, it's important to note that even though an individual may have an ACE score of 1, it only means that they have experienced a particular ACE. It does not show how severe or how frequently it has occurred. ACEs are potentially traumatic events that occur in childhood prior to the age of 18. Though preventable, ACEs can impact the way the body recognizes and responds to stressful situations. ACEs are assessed in various types: physical, emotional, and sexual abuse, physical and emotional neglect, as well as mental illness, incarcerated relatives, mother treated violently, substance abuse, and parent divorce or separation. It's important to note that these toxic stress do lead to those negative outcomes in adulthood. To overcome ACEs, we must build resilience. We have no roadmap to say, here's your directions, now go and do it. Rather, each of us within our own communities can interact and have mindset changes and can participate in the resiliency builders to shift the dynamics within our own families, communities, and society that lead to high ACE scores. Protective factors are conditions or attributes that when present in families and communities, they can increase the well-being of children and families and reduce the likelihood of maltreatment. Much of the work that was done with leveraging partnerships and community capacity fall within these 4 core protective systems as strategies to promote resilience. Our priority counties in the initial grant were focused on Greenwood, Union, and Lawrence counties. These are predominantly rural areas of the state, and they had high rates of substance use and overdose. Over 300 overdoses in 2020. Of these 3 counties, 60% of adults in the counties have reported of having an ACE score of 1 or more. The top 3 ACEs reported in these counties were parental separation, household substance use, and emotional abuse. We leveraged existing partnerships within these counties. Our purpose was to leverage cross-sector collaboration to prevent substance misuse in our counties that are most impacted by substance misuse. We partnered with Children's Trust to provide ACE trainings as well as the Strengthening Families programs. Healthy U and Cornerstone partnered with us to host Botman Life Skills and Strengthening Family programs. And then we partnered with Western Piedmont Education Consortium on the grant to help facilitate Handle with Care that you will learn about later on. We also partnered with law enforcement, emergency medical services, local community coalitions, and other state agencies. Our first strategy was ACE Master Training. Our goal in partnership with Children's Trust of South Carolina was to offer 3 different ACE trainings, train the trainer sessions to individuals who could then return to their respective organizations and communities to train others on the importance of preventing ACEs and promoting resiliency. We held the trainings virtually due to the number of individuals we had across multiple counties within the upstate and Midland regions. We held trainings in October, January, and July. Overall, the ACE presentations cover the neuroscience behind ACEs, the ACE study, and resilience, but it too provides strategies to empower communities to prevent ACEs. From our trainings, 62 individuals have been trained who represent a number of organizations and communities across the upstate and Midlands regions. We were strategic in who we offered the initial ACE presentation training to. Those individuals were school counselors, law enforcement individuals who work within substance use disorder treatment centers, and DHEC health educators and community health workers. From the initial individuals who were trained, they were able to go on and train an additional 403 individuals. However, since the end of the grant, additional trainings have been held and the impacts of this strategy are continuing to grow. There is quite the demand for ACE presentations and education in our state. Our second strategy provided us the opportunity to partner with both Healthy U in Union County and Cornerstone in Greenwood County in order to implement the Strengthening Families program and the Botvin Life Skills Parenting Curriculum to support families impacted by substance use disorder and trauma. Botvin Life Skills consists of 7 interactive sessions and Strengthening Families has 14. With that, 3 Healthy U and 2 Cornerstone Prevention staff were trained in Botvin Life Skills. Healthy U was able to implement 1 cohort of the Strengthening Families program. These programs teach skills to both parents and children on communication and family bonding. Looking at the impact of each of these programs, 11 parents completed the Botvin Life Skills with Cornerstone and 4 parents completed the program with Healthy U. Each one had their own unique challenges that came with recruiting. They did work and advertise with DSS, school districts, and libraries to help address that. 1 cohort was completed with Healthy U in the Strengthening Families program. 6 families completed that program. It too had its own set of challenges as it came to retaining families through the entire program. Parenting programs like Strengthening Families and Botvin Life Skills are great ways to build protective factors for children. Relationships are key components to resilience, and have a healthy, trusting relationship with one's parents can be a major factor in overcoming ACEs. And now we will transition to Jenna to talk about Handle with Care.
Thanks, April. And now for the remainder of our time together, we'll talk about Handle with Care, which is a program that we are really excited about and hopeful that there will be opportunities to continue to expand across the state. Handle with Care is a simple notification protocol between school districts and law enforcement where anytime an officer is responding to a call that may have been traumatic for that student, they notify the school to handle that child with care and keep an extra eye on that student and connect any out-of-the-norm behaviors to being a trauma response. Our goal for this program was to implement Handle with Care with initially just 6 school districts, but as we started getting the ball rolling, there were several other school districts that were part of the Western Piedmont Education Consortium that were interested. So we invited everyone who was interested aboard, and we ended up with 10 school districts that we were working with. The Handle with Care program is not something that we created ourselves. It actually comes from the Center for Children's Justice in West Virginia. They developed the program in 2013 to address their high rates of opioid use, and they saw a lot of success with that program, and it has since spread to all 50 states in some capacity. And since, I believe it was August 2021, it has started spreading here in South Carolina. And in just that short period of time, it is now in over 20 school districts. All of the school districts follow a standard model of fidelity that is set by the Center for Children's Justice in West Virginia. That's just kind of the general guidelines for the program, but even within that model, there are a lot of opportunities to really customize it to fit the needs of your own community. And we also always like to note that Handle with Care does not replace mandated reporting procedures, and it is not supersede any types of laws that are in place. And this is the Handle with Care flowchart that comes from West Virginia, and it really outlines the model of fidelity. I know I only brought 50 copies. I'm so happy with the great turnout that y'all have, but if you could share, that would be greatly appreciated. And we can send this out afterwards as well. But essentially, the Handle with Care protocol begins when a child is exposed to a traumatic event where a law enforcement officer may be present. So that could be anything from a parent being arrested to a sibling overdosing to a house fire. When the officer arrives to the scene, they assess whether or not a child is present and provide the typical care on scene that they normally would. And then before the start of the next school day, they'll notify the school to handle that child with care. And this is a simple notice, typically sent over email, that just has the student's name, their age, the school they attend, and the words handle with care. There's no information shared about what happened during the event so they can maintain that family's privacy. Typically, there will be 2 to 3 people on the school district level who are fielding those emails and then passing them along to the appropriate school contacts. And then it'll vary school by school on how far these notices go. Typically, they go to the school principal, the social worker or counselor, the school nurse, the school resource officer, and then just to those teachers that are directly interacting with that student. So it's really just sent out on that need-to-know basis so that those people who are interacting with that student can just keep an extra eye on them and provide support as needed. And 9 times out of 10, all that student really needs is just that extra smile when they're walking in the door. A lot of times those students who have been exposed to trauma may not have any visible signs that something has occurred. However, it does let that teacher know that any behaviors that are out of the norm may be a trauma response. So then that teacher may be able to make a referral to that student to the social worker, counselor, or nurse, who can then further assess if additional resources are needed. And we found that oftentimes that was mental health counseling, either for the individual student or for the family. But Handle with Care also provided the opportunity to learn if there were additional needs such as food insecurity or transportation, and they were able to make referrals to help meet those needs of the family as well. And of course, the overall goal of the program is just to make sure that school is a place where students who have been exposed to trauma are able to learn effectively. And as April mentioned, we did pilot this program during 2021 to 2022, or 2022 to 2023, with 10 school districts that were part of the Western Piedmont Education Consortium. And you can see that we were predominantly in the upstate region of South Carolina, with Greenwood 50, 51, and 52, Lawrence 55 and 56, Union, McCormick, Edgefield, Newberry, and Anderson too. And one thing that you can probably guess based on where we are on the map is that these were predominantly rural school districts. So we range with the smallest district in South Carolina, which is McCormick, with only 657 students, to Greenwood 50 that had about 8,600. And we did make sure as we were beginning this process to kind of assess that each school district had some type of capacity to meet mental health needs that were brought up as a result of the program. So whether that is a social worker, a mental health counselor, there was someone who would be available to meet that need. And then at this point, you may be asking why Handle with Care, or I have a feeling I'm in a room with some like-minded people, so you may not even be asking that question, you may already be aware. But Handle with Care really represents an overall mindset shift from looking at behavioral problems and asking what's wrong with you to asking what happened to you, and really looking at helping them heal from the traumatic experiences that they've had. Handle with Care identifies those students who may need resources or additional support, hopefully before those issues can really become exacerbated, and it may lead to them disrupting that cycle of trauma so that they are getting the help they need rather than potentially making harmful decisions such as vaping or substance use. Handle with Care also helps to build protective factors. Some of the biggest protective factors that promote resiliency is having a strong connection to school, and Handle with Care can really help those students feel like school is a safe place and somewhere that they feel welcome and are happy to be, and it may be a welcome escape from their home environment. Another protective factor that's really beneficial is having a positive connection with an adult who is outside of your family. And Handle with Care can help build that relationship between teachers, counselors, social workers, and the students. The Handle with Care districts in West Virginia, where they've had the program in place for long enough to be able to see these long-term outcomes, in Hamlin School District, they saw decreases in suspension, expulsion, and special education referrals following the implementation of Handle with Care. And we love Handle with Care because there's really low to no cost associated with this program. It's really just the time commitment, especially at the beginning as it's getting launched, but there's no physical cost associated with the program. And it has the potential to be very impactful to students. And in the one-year period that we were working with these school districts, we did see some really positive results from the program. Overall, there were 338 notices received across those 10 school districts. And I will note that this period of time that we're looking at is variable. So in that one-year period, we had Greenwood 50 coming on board in July, and Anderson 2 was the last one, not coming on board till March. So the amount of time that it was in place for each school district was different. And we did see that there were 32 referrals made in response to a notice. As I mentioned, they were primarily to mental health supports, but also to resources like transportation or food security. And we do estimate that that number was likely underreported in the feedback that we got from school social workers and counselors. They noted that it was sometimes hard to connect the referrals that they made back to the Handle with Care notice because the notice doesn't include information about what happened. We evaluated the impact of our program through stakeholder evaluation forms. We were really mindful when we created this. We had two separate ones, one for our school district and law enforcement leads who are really seeing the program from an overarching capacity. And then we had a second form for those teachers and school counselors who could really tell us more about how the program was impactful and how they are navigating their classroom setting. Overall, 100% of our survey respondents were committed to continuing Handle with Care, and that was really important for us to see because we hate to come in and implement a program just for it to go away when the grant funding ends. So we were really focused on just building up this infrastructure to create a program that would be able to continue beyond the end of the grant cycle, and we are really happy to say that with all the school districts that we've been continuing to reach out to, they have continued with the program following the grant. And overall, our survey participants described Handle with Care as being worth the extra work, that they were hopeful it would grow, and that it was something that they were glad to be a part of. And then that word cloud in the upper corner is just some of the other language that I pulled that our survey respondents used to describe the program. And now I'll kind of transition and talk more about the logistics of the program and the general way that it can get started in a community. So, of course, there are a variety of key stakeholders that you want to have support from as you're getting started with the initiative. And Handle with Care really cannot function without law enforcement. And we recommend including any law enforcement jurisdiction who covers where your students are living. So that'll typically look like the county sheriff's office as well as city and town municipalities. And we also have found a great connection. Our school resource officers have been really critical in getting Handle with Care started because they're already often serving as that liaison between the law enforcement department and the school district. We also began our implementation with support from the superintendent. That was kind of who we partnered with through the Western Piedmont Education Consortium. It was really helpful to already have that support as we were getting involved, and they kind of appointed who would be our main point of contact with the school district, and then that person presented to the school board. So we were really coming into an environment that was already ready for the program and excited to have it in place. And then in your individual schools, the principals, counselors, and nurses, and those folks who can really tell you about how Handle with Care could look in that individual school environment are really important to have involved with the program. And we would love it if you included our community engagement teams. We are in the process of getting all of our community engagement specialists across the state familiar with Handle with Care so that you can have someone right in your community who can provide this information about the program and help guide you along the way. And we've also seen some success working with our local coalitions as well. That's often a great way when you don't know where to start to really talk and see what kind of connections you already have in your community and what can be leveraged. We saw a lot of success in McCormick County where one of our partners who worked at the Substance Use Authority, her husband was working at the sheriff's office. So that really provided us with a great relationship to already have that support going in. And we also want to acknowledge the importance of teachers in the program. We try to make this as less of an ask as possible for our teachers because we know how overburdened everyone already is. So we, instead of like bringing everyone in, doing an entire giant in-service for all the teachers, in a lot of cases we were able to develop just like a 10-minute or less video training on what Handle with Care is. And that's something that they can watch when they get it, or they can refer to back when they get that first notice. And just trying to make it the least ask as possible to those who are already overburdened. And the timeline for implementation is very variable across all the different communities. Some may be ready to go in a month or two, and some it may take, a year or more to get all the partners to the table and make sure the community is ready to have it be as successful as possible. The first step is really to determine if the community would be a good fit for Handle with Care, and in a couple slides I'll kind of break down some of the different things that you can look for and ways to kind of leverage getting the conversation started. And then it begins with just a simple introduction of Handle with Care to community leaders, and that can be as simple as talking to one of your friends who works at the sheriff's office, or if you have a friend of a friend who knows the superintendent, just starting to leverage those conversations really informally, beginning to make sure people are aware of the program, and it can kind of snowball from there. And then once people are, hearing about it, it's coming up in community meetings, then they may be ready for an interest meeting. And that's the first kind of formal Handle with Care training where you'll bring in your school district and law enforcement partners and really just start to discuss what that program will look like in that community. And just really starting to talk through all of the different challenges that may need to be navigated. And then following that meeting, there will be a second kickoff meeting. That's the more formal launch of the program. And in between those meetings, you will want to put a memorandum of agreement in place between the school district and law enforcement entities. And it may take some time to navigate that. The Center for Children's Justice in West Virginia has some really great templates that walk it through. But if you're dealing with, potentially 4 or 5 jurisdictions, it may take some time to get language that everyone is comfortable with. And then you'll also need to confirm what the protocol looks like on the law enforcement side. Is it going to be individual officers sending the notices, or perhaps the shift captains are sending it for all of their staff? So there are some things to consider on that end. And then how you want the school staff to be trained if you need to identify what that protocol will look like as well. And then following the kickoff meeting, there will be a plan in place to train law enforcement and school personnel to be ready to send and receive the Handle with Care notices. And then following that, there will be time to evaluate the implementation. We recommend keeping track of the number of notices received. We created a notification report template that kept track of the number of notices, the source of the notice, so which law enforcement agencies were sending them, and the number of referrals made, and then where the referrals were made to was the data that we kept. And then we also evaluated through the stakeholder evaluation forms that I mentioned earlier to kind of get an overarching view of people's perspective on the program. And we summarized all of this into recommendations and solutions for improvement that we made to each of the school districts at the end of the grant period with an overarching view of the different challenges and recommendations we had to resolve them. We do acknowledge that every community is different, and Handle with Care can really be customized to meet the needs of each community. And we found that our champions can be found in unexpected places, and there's no one-size-fits-all for who can champion the program. On the law enforcement side, we had a lot of success working with our school resource officers. They were really excited about the program and happy to serve as that liaison. As well as victim advocates seem to be a lot of the people that just kind of get it naturally in the work that they're already doing. On the school district side, the main person we worked with was really variable. We worked a lot with social emotional learning coordinators, directors of multi-tiered systems of support, district social workers, counselors, or nurses, and just, it's all about the person, choosing the right person to lead the program on both sides. And each school is going to be different in the types of accommodations that they have available to students. So if they are allowed to offer extensions on assignments, that could be something that can be talked through, if there's a standard for how long an extension to offer, or if they can get additional time on tests as a result of a notice. If there's a designated calming space in the school, that can be a resource where students can be sent to. and the process for referring students to counseling or guidance services. And it can be different in who can send notices. We worked predominantly with law enforcement, but if you are in a county that has a variety of different law enforcement agencies and the sheriff's office is ready to go, but maybe some of the municipalities are more hesitant, you can go ahead and start with the sheriff's office if they're ready, and maybe you'll be able to generate some data to support the program and can use that to gain the buy-in from additional staff or additional departments. Some jurisdictions across the country have worked with EMS or fire department services as well to send the notices. And then some school districts have even allowed parents to send notices as well. And then each community can be different in how the notices are sent. We use confidential emails, but there are also opportunities to potentially use Google Forms or REDCap surveys, or we're now looking into how it can be incorporated into the existing officer reporting system, so that while they're completing their report, it'll prompt them to send a handle with care notice if a child was present. And then here are some factors that you can consider when you're looking to determine if Handle with Care is a good fit for your community. You can look at what the existing relationship between the school district and law enforcement is like. Where are the school resource officers coming from, if it's one of the smaller municipalities or if it is the county sheriff's office. And there also may be some initiatives that the school district and law enforcement agencies are partnering with already where Handle with Care can kind of fall into that and can be part of that conversation. We also considered if the district already has some type of trauma-informed framework in place and if they have mental health resources available to meet the needs of students, because as we all know, you don't want to be assessing for a problem and not have a resource to refer someone to as a result of that problem. So we worked with school districts that had some type of multi-tiered systems of support in place or a social emotional learning framework, and if they had some type of mental health resource on site or in the community. And it was really essential as, we are DHEC, we are not working, for a law enforcement agency or for a school district. We really wanted to make sure this was an initiative that was owned by the community. So it was really facilitated by our main law enforcement and school district contacts, and we were just kind of there to provide that technical assistance and support and help them navigate the challenges that came up. And if you're in a county that has multiple school districts, consider if this would be an opportunity to partner together to implement the program, because oftentimes if the sheriff's office is sending notices for one school district, then they're potentially interacting with students where they have the capacity to send a notice, but they're just not because the school district's not prepared. So there would potentially be an opportunity for them to send notices for everyone, and then an opportunity for the school districts to really strengthen that relationship with each other as well. And then as DHEC, we often work with local coalitions to determine health priorities for each community based on the data and what the community thinks the health priorities should be. And sometimes we already have a Resilient Children or a mental and behavioral health coalition in place. And that could be a great opportunity to start the conversation because, as coalitions, we're always looking for something to do, some type of initiative to implement in the community. And they may be interested in Handle with Care as one of their strategies to address those issues. And in the time that we have been working on the grant, we do have a variety of resources that are available to support the program. We developed a Handle with Care manual that really outlines all of our experiences, and we do have a few copies up here if anyone is interested in kind of flipping through that and getting a little bit more information on the work that we've been doing. We developed presentation templates so we can provide a simple overview of what Handle with Care is, and we also have presentations to guide the interest in kickoff meeting processes and evaluation presentations as well, that recommendations and solutions for improvement and really kind of walking through a SWOT analysis for that community and the initiative. And we'd be happy to share the feedback surveys that we used, both for the individual teachers and counselors, as well as for law enforcement and school district partners. We also held some focus groups to get some more qualitative feedback, and we have those questions available as well, and the notification report template that I mentioned. We'd also be happy to connect you with some of our partners in the school district and law enforcement side that we've been working with. We have gotten a lot of great feedback from them, and some have said that they would be more than happy to talk to people who are interested in the program, so we'd be happy to help make that connection. And we also have the Understanding Adverse Childhood Experiences and Healthy Outcomes from Positive Experiences presentations available. I will say that ACEs presentations will be a little bit easier to schedule because we do have staff across the state who are trained who can help you get that scheduled. And then for Healthy Outcomes from Positive Experiences, it's just myself, April, and Community Engagement Director Lily Hall who are trained in that program, so it may be a little bit more time before we can get that scheduled, but we will work with you to offer those programs, and all of these are available at no cost. We do want to end by just saying that whoever you are in this room, can be a champion for Handle with Care. You can be the one to start that conversation, whether it's informally with some of your coworkers when you get back to work. You can also schedule an Adverse Childhood Experiences or HOPE training for your team. We've got our business cards up here, so we'd be happy to either connect you with a trainer in your area or work with you to get something scheduled. We can help you to network with other Handle with Care sites, or if you already have a friend that you know who's in Lawrence or McCormick, you can reach out to them and kind of get their perspective on the program and just kind of see how it's being implemented and get some feedback from others. You can leverage the relationships and connections that you already have through the work that you do, or if you're involved with any other community groups where there might be folks who are interested in this program. You can present Handle with Care to stakeholders once you've kind of got that interest garnered. And of course, we want you to continue what you're already doing in supporting those students who have experienced trauma. We know that everyone in this room is here because they care so much about the mental health of children specifically, and we just really appreciate the work that you are already doing. And we'd love to open up for questions and discussion. April, I'll invite you back up here. Yeah, that's a great question. I think a good starting point might be bringing it up at a parent-teacher association meeting, or maybe even just to whoever you have a relationship with at the school, if that's your child's teacher or a principal or counselor, just kind of starting there and kind of gauging interest would be my recommendation for getting the conversation started. Absolutely.
Can you repeat the question that she asked?
Yes. She asked how, as a parent, could you get involved with Handle with Care? You mean like them getting Handle with Care notices at Girl Scouts or Boy Scouts or after school programs? Right. No, I believe it was just at this time to the school staff specifically, although I will say we recommended that they include or continue to send notices over the summer. So if that student is in summer school or a summer program, they would be able to get the notices. And that recommendation is also to help keep law enforcement officers in the practice of sending notices. But there definitely are opportunities to expand to include those after-school programs. We just did not at this time. The question was if we are still offering the ACE Train the Trainer sessions. At this time, we are not offering the Train the Trainer sessions. This would just be the 90-minute presentation on ACEs. I will say that we did meet with someone in Florence School District 5, I want to say last year, and just kind of had a preliminary conversation, but I'm not sure what has happened since then. We're in a fortunate position where they were already on board at the time where we started the grant, so they were through the Western Piedmont Education Consortium. I will say that that was a consortium of 13 school districts and only 10 elected to participate. But since the end of the grant cycle, we've really only been working with those who have reached out to us. There was already that interest there, which has been tremendously helpful on our end. Absolutely, and April and I are here to support all of our staff across the state in getting this initiative spread out. So I think as everyone's getting started, we'll still be pretty hands-on in the process, but you will have that direct contact in your community who's already familiar with that work, which is just absolutely phenomenal. Thank you so much.
Well, let's give them a hand.
Oh, we got it.
Got a few extra minutes. You can